In this video, you're going to be hearing from people with disabilities from across the state about their experiences in getting health care. We want to raise your awareness, help people around the state become aware of the problems that people with disabilities face in getting health care. And we also want to talk about helping healthcare professionals do better by offering disability etiquette, so that you know how to implement or how to talk to and be welcoming towards people with disabilities, so they will come back and get services rather than end up in the emergency room, which is not conducive to their quality of life and is certainly much more expensive.
For right now, the main thing I have is I can't get a pap smear. I can't use the bottom half of my legs very well because of spinal stenosis and neuropathy, and so I can't get on the table to where they can give me a pap smear, which is really bothering me because the last pap smear I had, which was about 3.5 years ago, they saw growth. And so I'm concerned about that because, as you know, there's cervical cancer, and without the Hoyer lift, I am absolutely paralyzed in helping myself get anywhere, getting a weight. And so I'm frustrated because there's nothing else left I can do. But God, there must be millions of people like me who are paralyzed from the bottom up. They can't get a pap smear or something. I can't believe this.
Because of the lack of accessibility, there are a number of treatments that I can't have. One being weight. One of the major issues, though, is pressure sores, being in a wheelchair. And to describe to a primary care physician, I've got some skin concerns, but nowhere for them to examine me. Sometimes we'll try very precarious transfers onto just a small patient table, but that terrifies me. I'm aware of quadriplegics that have been dropped and broken their neck a level higher. And if I were to sustain a different type of spinal cord injury because of it, I would lose the ability to drive. I'd lose my occupation. It just terrifies me. For me to go try to be treated for any condition or even just a well care visit, but not to be able to have that entire examination is just really inexcusable. For an able-bodied person to walk into a clinic and the hospital say, "Oh, I'm sorry, we don't have needles to give you the transfusion today," or to say we don't have a stethoscope to listen to your heart even though you have cardiac disease of some sort. That would be intolerable in society. People would be at such an outrage. Yet, for a person with a disability, that's what we face every time we go to the doctor.
I kind of see the issues with hearing loss from both sides because I've been a patient with hearing loss, but I've also been a healthcare provider with hearing loss. It impacts not my ability to get into a place to get health care like it would with someone with a physical disability, but it certainly impacts my ability to access the information once I get there, and even before that, when I call to make my appointment. Sometimes with more and more stuff being done on the computer, sometimes the person talking to you is looking at a screen either down below them or off to the side, and they're not making face-to-face eye contact with you. Many of us with hearing loss rely on reading lips to supplement those pieces that we miss. And most people at the reception desk really don't seem to be aware of that with people with hearing loss. And I think that's an issue for people with hearing loss, but it's also an issue for people with cognitive disorders. It's also an issue for people who are just busy and distracted.
We spent some time in this video talking about healthcare and the costs. So there's two impacts that happen here. One is the quality of life that person has, and the other impact is, of course, the cost. We know that emergency room treatments are most expensive and can be prevented with primary care access. So our whole point here is to make primary care, specialty care clinics accessible and usable for people with disabilities. And you do that in two ways. You make their service, their facility, their equipment accessible to them, and you make sure that the people who are treating them see them as people and see us as people and provide quality care as they would to anyone else. We want to move into disability etiquette. And the attitude that you as a care physician, as a care provider have towards that consumer or your patient will determine whether or not they come back, whether or not they follow your protocol, and if they don't, then they're going to be even sicker, and their quality of life is going to deteriorate, and our healthcare dollars will be unnecessarily spent. We do a lot of things in doctors' offices to make people without disabilities feel welcome. Magazines, water, all those kinds of things, TV, but we do nothing to help people with disabilities feel welcome. And then we wonder why this cohort, this group, ends up in an ER situation as opposed to going to their primary care physician.
Honestly, I think the stigma is very, very high with their mental health. I was in an accident last year, and so I was on the scene for a little while, and I felt I needed to go to the ER. So they called an ambulance, and so I hear him calling in to the ER, and I disclosed, "Do you have any issues?" I said, "Well, I have a diagnosis of bipolar." And it's interesting how it all shifts from medical to even saying, "Well, she says she's bipolar, so I don't really know how real this is. I don't." And it was so dehumanizing for him to prejudge me based on my disability. That happens quite a bit. This stigma is a huge, huge barrier for me. It's very difficult for people to take me seriously, and so many times I take my husband, and then it's like, okay, now you have credibility because he sees this and we take his word for it, but not me.
When they just talk to me and then I say, "I can't hear you," and they just speak louder, my eyes get all, I look at them and I try to make them understand I'm deaf. Then I see this facial expression that obviously makes me feel like I'm a burden, and I don't appreciate that. And they get upset and they think I'm dumb or, stupid, or, like they should know better, or I should know better. And those situations are not the kind of things that I like to experience. I can give them the benefit of the doubt, and I understand that mistakes happen, but when they're willing to come halfway and give me the confidence as a deaf person to know that they're trying, I really appreciate that person, and I do go to them more often when I can.
I actually ended up hurting my foot, and I had to go see a specialist. They told me that I needed to ask the person that I was with to come back, and I asked them why. And they told me that because I was blind, I had to have someone with me, and it was a rule in that office. And they said, well, then we'll have to reschedule. And I told them I couldn't reschedule because I was about to leave town. I kept asking and I kept pushing, and so they went back to ask the doctor, and the doctor said no, I had to have somebody with me. And I asked, why? Is there something that I'm going to be doing back there that requires an extra amount of assistance? And they said, we can't talk about that. We can't tell you what happens in the back. But as soon as I pulled out my phone, they were like, well, maybe we can work this out. And so eventually they did end up letting me in, and it was all fine. I didn't need any extra assistance. I found out I needed to wear one of those foot cast boots. I needed one of those, and if I had just gone on my trip without it, I could have caused more damage to my foot.
So now you've seen how people with disabilities, with physical disabilities, experience healthcare or lack of it. You've seen how the etiquette, the healthcare professionals' attitudes and their assumptions about you about the person with a disability, how that impacts care and how it impacts the individual. So we're asking you to help us in terms of, we really need to have our Medicaid division in this state conduct surveys, identify where are the accessible healthcare facilities and clinics around the state, and make that available on a website so that I, as a consumer, can decide to go to a physician who understands people with hearing impairments. So that we can make those determinations, but we need that information. And secondarily, and most importantly, we need physicians and healthcare providers to have training around how to interact with us in a respectful and encouraging way that brings us to come back to continue our healthcare and avoid a deterioration of our condition, ending up in the emergency room. But we cannot do this alone, and we need help in convincing the physicians and the healthcare professionals to take these steps so that we can receive the health care that everyone else receives.
For more information, contact the Independence Center at 719-471-8181 or at www.theindependencecenter.org.